welcome to our first episode of Brain Health Today. This is Scott Larson, your host, and I will often be joined by our guest, brain health expert, David Larson. Dave and I share the same last name, but there is no known relation as far as we know, right, Dave?
Right. That's what I know.
Okay, very good. The purpose of this program is to provide valuable information that will help viewers to keep their brains healthy. Many people overlook the importance of keeping the brain, perhaps the most important organ of the body, healthy and well. We eat well, exercise with the hope of keeping our bodies healthier longer, but much of that doesn't matter if the brain doesn't receive the nutrition that it needs. Our guest, David Larson, is a former master trainer for the Alzheimer's Association's Maintain Your Brain program. He's also a published researcher in the field of Alzheimer's and dementia interventions and a director of education for the American Brain Council. He's a popular instructor of healthcare professionals nationally on the topic of brain health. So, Dave, welcome to the program.
Thank you, Scott.
Today, Dave is going to talk with us about the exciting new findings from the latest research into reversing cognitive decline. Dave, is it possible to actually reverse cognitive decline? And if so, how?
Yes, fortunately, in most cases, Scott, it is. And I'll give you some examples here with some ideas as to how to get it. Last year, for example, in the prestigious medical journal Lancet, four international experts who noted that many, if not most, cases of serious memory loss or dementia, including Alzheimer's, in fact, were due in large measure to modifiable risk factors, such as high blood pressure, diabetes, poor diet, hearing loss, smoking, lack of mental stimulation, too much stress, and a lack of adequate sleep. Those are some of the things they identified. So all of which, of course, are modifiable. So it stands to reason, they noted, that if one can catch and modify these conditions soon enough, that's going to delay, if not prevent, cognitive decline as we age. And actually, about 4 years ago, now, just last month, another major controlled study in Finland came out or was presented with that study involved more than 1,200 seniors with mild cognitive impairment and basically proved that it is, in fact, possible to reverse cognitive decline, to keep them from continuing on to dementia. In this study, half of these individuals were told to go see their physicians and follow their advice as usual. The other half were taught what constituted a brain-healthy lifestyle, i.e., what constituted a brain-healthy diet, appropriate physical and mental activities, and appropriate social interaction. And then they were encouraged to follow these guidelines. And after 2 years, those on the better diet and lifestyle performed 38% better on memory tests. They were 80% better on reasoning and problem solving, and other and their mental processing speed, which happens to be one of the best markers of brain health. Their processing speed was actually 150% better than the placebo group, showing that even those with cognitive decline can improve if they're taking and doing the right things. Now, that takes some time, but it's doable. Now, fortunately, 2 years earlier than that, I had the privilege of being involved in another study which had even quicker results. I was invited to help conduct an arm of a study funded by the Alzheimer's Association. It was about a $250,000 study given to the University of Massachusetts to test a particular formulation that they had developed for improving brain health. In this placebo-controlled blinded study, more than 240 subjects with various levels of cognitive impairments, especially memory problems, I would say. Most all of them had memory problems. When they were given this nutritional supplement, those who were given it, within 3 months, most of them improved. Actually, about 60% of these individuals with cognitive decline were remembering better. in approximately 3 months. That continued on for about 9 months. I mean, some responded faster, some it took a little longer. But again, 60% or better of these individuals, many of whom have significant impairments, improved. Now, in another study at University of Massachusetts with that same nutritional formulation, with healthy individuals who didn't have cognitive decline, after 3 months, these healthy seniors performed on memory tests like those 10 years younger. And of course, most of these ingredients are now found in the memorized drink mix. Moreover, one of the interesting things researchers have found since is that this same formula may improve hearing as well. You see, one of the contributors to both memory loss and hearing issues is something called high homocysteine. This is a marker of inflammation in the brains and arteries. And 3 of the nutrients in that formulation have been shown to significantly reduce that homocysteine. In fact, others of them might help as well. And in one study at Oxford several years ago, they found these 3 simple nutrients significantly diminished brain shrinkage and memory problems over a 2-year period. And they worked synergistically with these other nutrients to affect even greater improvements quicker. And of course, the people can hear better with newer, better hearing aids, and these nutrients, they will be able to interact better with others, which builds cognitive reserve. And we know that can bestow additional cognitive benefits and further reduce risk for decline. So in answer to your question, Scott, what these studies are teaching us is that, yes, many, if not most seniors experiencing memory problems or age-related cognitive decline can improve with the right diet, nutrients, and lifestyle if the right steps are taken and the right things are done soon enough. So the sooner the better.
That is great news for people who are struggling with cognitive decline or perhaps have family members who are suffering. In the future, we'll discuss things that have been shown to contribute to brain health. So thank you very much for your time today, Dave, and thank you to our audience as well. Please join us for future episodes.